All right, this will be the first lecture in a series on mental health and psychiatry. We're going to look here in this first video at sort of the general definitions of mind and mental health, look at something called the biopsychosocial model, which is kind of the primary biomedical approach to mental health conditions, talk a bit about Chinese medicine and its relationship to mental health and the nervous system, then we'll integrate that with the threefold physiology and come back to that discussion about the nervous system and the biophotons in the inner light. And then in future videos, we'll look at specifically some of the psych meds as well. I'm going to look at classification of mental health disorders and then finally assessment of mental health conditions. So the mind is considered to be part of the psyche, the human mind. Again, soul and spirit are often intermixed. But if we just kind of stick with the classic definition of the psyche, it's your inner world of feelings and thoughts. We can say there's a higher aspect of that where we get novel thoughts, novel inspirations, and that we might relate more to spirit. So I'm going to be using the word mind here more in relationship to the soul. And by definition, this is a set of cognitive faculties, including consciousness, imagination, perception, feeling, judgment, language, and memory, which is housed in the brain. Now, again, even in neurophysiology, there's some interesting discussion. Is consciousness really just part of the brain? Or is the brain more of a receiver for consciousness? And are all of the organs necessary to create and generate consciousness? And there's some very interesting research looking at organ transplants and how the consciousness of the donor is often retained in the recipient, at least for a while. So it really opens up the discussion that we need to look at the whole body, really the embodied mind, not just something that's part of the brain. In biomedicine, again, the mind is equated with the brain, but this is a pretty new perspective because in the historical, the humoral medicines and whatnot, really the mind was connected with the bodily processes. And it wasn't until the 19th century that we really had a full separation between that. René Descartes in the early 1600s said that the mind, the psyche, the soul was actually received by the pineal gland, and that the rest of the body was just, body, so that there was still a place that was kind of considered sacred in the sense that it was receiving the soul activity. But the modern kind of view is that more and more we're realizing that the functions of the organs, the muscles, are all very important for determining different aspects of what we call mind. In terms of the kind of basis of approaching mental health conditions and so forth, it usually does rest in the body, and we'll talk about the biopsychosocial model, which is the primary biomedical approach to how these things are addressed. So mental health disorders are diseases of the mind. The American Psychiatric Association, APA, puts out a book, you've probably heard of it, called the DSM-5, Diagnostic and Statistical Manual of Mental Disorders. It's in its 5th edition now, and really describes mental health disorders in terms of characteristic signs and symptoms. So we define them as syndromes, and they result from a dysfunction of either the psychological, biological, or developmental processes that underlie the workings of the mind. So really, when we look at mental health conditions, we have to look at the biology, the psychology of the individual, and then the social conditions, and that's the biopsychosocial model. Mental health disorders are defined as abnormalities in either thought processes, thought content, perception, mood, affect, or motor activity and behavior. And I've defined them here to the right here. So affect really is your outward display of feelings and emotions. They can be objectively observed by therapists, for example, and the range can be between normal and flat to blunted, broad, inappropriate. So that's one aspect, is affect. Mood is your subjective feelings, emotions. So if you feel depressed, that's a mood. Psychosis is significant, transient, or persistent impairment in reality testing. And reality testing is defined as the process of comparing thoughts or ideas to information gathered from the external world. So does your inner world really match what's going on in the outer circumstances? And in psychosis, there's usually a tremendous break between those two. A thought disorder is an abnormal thinking affecting a person's language, communication, thought content, or thought processes. So all of these can be disturbed in different mental health conditions. Now, importantly, DSM-5 and the APA defines these as deviating from the social norm for an individual's culture, and they impair social functioning. So it's interesting to think that some of these behaviors might actually be normal in certain cultures, and so that they become abnormal when they're brought into, let's say, they come to the United States and so forth. So for the most part, though, we generally have culturally and kind of universally defined values around these things. But strictly by definition, they're defining it as deviations from the normal social norms. In terms of mental health professions, psychiatry, psyche plus iatros, which means doctor. This is a medical specialty, so psychiatrists have to go through medical school. They're either MDs or DOs. They have a 4-year medical degree, and then they do usually an additional 4 years, typically, of residency and perhaps more fellowship on top of that, focus on mental health disorders. Psychiatrists can prescribe psychoactive medications. This profession really arose in the 19th century in working in asylum patients, where patients were put into these institutions with mental health disorders, and they were then cataloged and categorized based on the types of disorders they had. So psychiatry kind of arose from that. Now, psychiatry is highly tied in with neurology. In fact, in the training of psychiatrists, they do a lot of neurology rotations, and the neurologists have to do some psychiatry rotations. But neurology is more the profession focused on the brain and nervous system, and looking for lesions. We went all through that in the neuro block. That's the proper role of the neurologist. But things like brain tumors, increased intracranial pressure, all these kinds of things can cause cognitive impairment, can affect all those different mental health definitions that I just spoke about. So there's often a cross link between those two. Psychology, and a psychologist is usually a person with a master's degree, and they have additional clinical training, so they might become a clinical psychologist, and these are non-medical degree programs. And for the most part, I don't think of any jurisdictions that allow psychologists to prescribe medications. There was a bill introduced in Oregon just last year that tried to propose that, but that was quickly shot down. So at this point in time, at least, psychologists don't prescribe medications, but they do use the whole battery of different mental health kind of techniques and so forth to work with patients. So those are the primary kind of mental health professions. Now, in the biomedical understanding, the biopsychosocial model really states that mental health disorders result from a combination of factors, including the biological, including the psychological, often related to emotional development, and including the social. And this model was really developed by George Engel and John Romano at the University of Rochester in the 70s. And they argued, and this is what has kind of been adopted, that approaches to mental health disorders should consider all three of these. So biological factors are probably the ones that are most focused on in the current therapies, at least with the medication therapies. And that is that we know, for example, that many different physical disorders, for example, disorders of the liver and the kidneys, disorders of head injury, vascular issues and so forth, can all lead to mental health conditions. And now we're realizing that on a more subtle level, there are a lot of genetic markers. So, for example, everyone basically has different single nucleotide polymorphisms for the serotonin transporter. So we all handle serotonin differently. And so some people clear serotonin from their synaptic clefts very quickly, others very slowly. Same thing for MAO and COMT. Remember, these are enzymes that also break down serotonin, but also norepi and dopamine and so forth. COMT is a methylation enzyme, and if you have methylation defects, remember a methyl group is just a CH3. If you can't methylate properly, then you're not able to detox, for example, norepinephrine adequately. So that will accumulate. And remember, norepinephrine leads to anxiety, so people will be more prone towards that. So that's the role of genetics and polymorphisms. And a lot of twin studies have kind of demonstrated that connection. We have this idea that many of these different mental health conditions are associated with neurotransmitter imbalances. Importantly, the neurotransmitters are only a piece of the pie. We're now learning more and more that there are many brain areas, even body areas that are involved in addition to just these neurotransmitters. But in terms of consideration for medication, talking about over or under activation of different neurotransmitters is often what's discussed. So in depression, We think that, for example, there's lower serotonin in general and perhaps lower norepinephrine. And we could say also a third one here would be lower potentially dopamine. With anxiety, there's usually lower GABA, lower serotonin, and usually higher norepinephrine. So that could be, for example, from that methylation defect, you have more norepi all around. In bipolar mania, there's usually really elevated norepinephrine. And remember, norepinephrine is in the central nervous system involved in alertness and attention and concentration. In the peripheral nervous system, it's involved in the sympathetic nervous system, the fight or flight response. So we could say in the manic state, there's sort of a sympathetic overactivation. In schizophrenia and in psychotic states, usually there's an elevation of dopamine. Alzheimer's, we talked about that as a depression of acetylcholine, and then Parkinson's, depression of dopamine. So those are very simplistic kind of associations, but it's sometimes helpful to keep those in mind. Now we know, for example, that in addition to that, a lot of those glial cells that should be supporting the synapses also are involved in this. So if they don't secrete adequate nerve growth factors and other things, there can be a problem with the neurons and the neurotransmitter levels. Another big aspect would be neuroendocrine imbalances, and that's looking at how the endocrine system, the hormones, actually play in. A lot of these hormones, especially the steroid hormones, get into the brain, they cross the blood-brain barrier, and they have major effects. So adrenal hormones like DHEA, but then sex hormones, estrogen, progesterone, testosterone, and interestingly, neurons can actually synthesize some of these hormones, and they're supporting glial cells. So for example, we know that progesterone actually can upregulate GABA. So that's why we think progesterone has sort of a calming effect. Dopamine can upregulate dopamine. Testosterone can upregulate dopamine. And then estrogen can upregulate serotonin. So basically, we can see that these hormones are going to be involved in sort of protecting the levels of neurotransmitters and their activity in the central nervous system. Thyroid disorders, subclinical hypothyroidism. We'll talk about that in depth later. But thyroid basically is extremely important for nerve signaling. In fact, congenital hypothyroidism can result in a condition known as cretinism, and a baby is born with really short stature. They don't grow very tall, but they also have often severe mental retardation. So that's due to the lack of the adequate thyroid hormones in utero, and that's why we're really concerned about keeping thyroid hormones level normal, especially during pregnancy. We know stress, the HPA axis in your adrenals with cortisol and so forth, can play a major role in even changing gene expression. So that changes your epigenome, and that actually can change how the different genes express, the activities of different neurotransmitter receptors. The cortisol will suppress things like thyroid and sex hormones. So it's a complicated mix, but we're realizing that this is extremely important for determining brain health. And then melatonin, very important obviously for sleep, but melatonin is a major antioxidant for the brain. And so pineal secreted melatonin can get in and protect neurons and so forth. So that's hormone imbalances. Nutrient deficiencies, major factor here as well. Many of these are cofactors or coenzymes in the enzymes that make the different neurotransmitters. So many of the B vitamins, especially B6 and B12, and folate, which is B9. It's often good, that these are in methylated form if they're taken as supplements. But generally, we want to look at really focusing on diet and whatnot. There is a role, it's called orthomolecular psychiatry, and that's using high-dose vitamins to basically in place of medication to correct different neurotransmitter or metabolic imbalances. It's very debatable. I have seen some, I don't use orthomolecular psychiatry myself in my practice, but I have used some of these supplements, and they have for some conditions shown benefit. I do find that working with the hormone imbalances is probably one of the most important things. And then we'll see that there's other issues. For example, and I didn't actually link it here, we do suspect that there's mitochondrial dysfunction in the neurons with a lot of different mental health disorders. And so a lot of the nutrients that improve mitochondrial function, like CoQ10 and riboflavin, B2, and L-carnitine, which helps fatty acid combustion, and lipoic acid, all of these are very helpful there. A lot of the minerals, magnesium, very important for depression. Iron can be as well if a person is anemic. Zinc, selenium is an antioxidant, and so forth. Data is still emerging, but seems to be weighing in favor of certain fatty acids being very protective for the brain, especially in children. And then different amino acids often can be used therapeutically but are found to be deficient. So if remember, tyrosine is the precursor to dopamine, norepi, and epi, tryptophan to serotonin, and then GABA is a non-protein making amino acid, but it's an amino acid, and ingesting it, interestingly, can increase the amount of GABA that's synthesized in the brain. So deficiencies of these might create some issues. And then I've listed some of the other areas, poor GI function. So we now have a lot of discussion about the gut microbiome and about how different microbiome states can influence systemic inflammation. That through the vagus nerve can feed back to the central nervous system, creating issues there. Poor liver detoxification, cholestasis. I'll come back to the microbiome. If we kind of look at it from a Chinese medicine context, should really argue the microbiome is part of your life activity, all your life forces inwardly. But that the microbiome is actually highly regulated by the body, by your organ functions, and so forth. And I find that discussion is often not emphasized in a lot of the microbiome talks that are being given now. So it's important to look at your liver function, your kidney adrenal function, your thyroid activity, which a lot of that determines your gut motility, and that will actually determine your microbiome, etc. So all of those factors are things I feel like I can address clinically. There's not a lot. The studies looking just at giving probiotics, prebiotics have a lot of mixed results. There is a trend in some studies towards benefit with depression and so forth, but I think it's a lot more complicated than just throwing in a few probiotics. We have hundreds, of course thousands really, of different strains of bacteria in the gut, and just a simple supplement's not going to fix that. But if you correct the terrain of the gut wall, the nutrition to the gut wall, all the hormones and so forth, then it's going to give the beneficial microbes more of a capacity to grow and to establish. So I feel like that's important to look at. Addressing systemic inflammation, we know that's important in depression, for example, and then methylation status can be important. Now I can discuss methylation testing and whatnot later. That's a kind of a somewhat controversial area. It can create kind of a burden on the patient for testing. There are some markers of methylation in the body, for example, homocysteine, which is a simple blood test, which I tend to use more than any of the gene studies looking at methylation enzymes. But that's something to think about. Pherols basically are abnormal breakdown products or abnormal synthesis products of hemoglobin. And so this is related to the porphyrias. Porphyria is usually due to light sensitivity due to accumulation of these different abnormal hemoglobin or molecules in the blood. So in a pyrrole disorder, there are these abnormal heme metabolites, and we think they actually can have effects on the central nervous system. So that's part of orthomolecular psychiatry. They argue you need a lot of zinc and B6 and whatnot to kind of help the body detox that, and there's a lot of elaborate testing for that. So in some people that could be useful. And then copper overload, zinc deficiency, these are also correlated with different neuropsychiatric states. So that's just some of the biological causes of in the biopsychosocial model. Again, I'll point out, when looking at neurotransmitters, we tend to think of serotonin as involved in memory, as involved in kind of calming the nervous system, sort of a feel-good, all-around general hormone, versus dopamine is more involved in reward and pleasure and drive. And then your norepinephrine or noradrenaline is involved in energy and alertness and concentration. And they have crossovers, but we tend to think there's a balance between these for healthy cognition, emotion, and mood. Again, very simplistic, but we'll be coming back to that in the psych med section, discussing that idea further. Now, the biopsychosocial model also includes psychological factors, and the idea here is that experiences during childhood or early adulthood can profoundly influence a person's mental and emotional life. So your family environment and upbringing, trauma, sexual abuse, development defense mechanisms also are important to look at. So it's not just about medicating and fixing a biological issue. We have to address this as well. And then social factors, often overlapping with the psychological ones, would be basically that we have issues with gender and age, marital status, social support, economic status, community infrastructure. All of these go in also. So as part of therapy for a patient, these would all need to be addressed as well. So that's the overview of the biopsychosocial model. Now, in Chinese medicine, the mind is usually equated with the Shen, or Jing Shen, the essence spirit. And Shen is not seen as something separate. It's seen as working through the body. So we can say it's reflected through the organs. And it's not just one part of the body, the brain, for example. It includes the whole continuum of the organ systems and so forth. If we have to say, though, what is the primary overarching organ that houses the Shen, that allows it to function in the body, it would be the heart organ system, which in Chinese medicine includes the entire cardiovascular system and blood. And that would also imply the immune system, which is carried by the blood as well. So we can think of that as the seat of the Shen. So heart with a capital H here really is the whole cardiovascular system, the heart, the blood vessels, the capillary beds. And what they do is they regulate the metabolism in all the tissues, and they deliver hormones and remove waste products. So it has this overall overarching homeostatic role in the body. The Shen is said to circulate through the vital channels, the Mai, which we might very well link to capillary beds in a way, and that would be part of that whole heart system. And it's related to the element of warmth or fire. And we just think about what the blood flow does. It really brings the oxygen to the mitochondria, which then generate the warmth in the muscles and so forth. So when there is a flow of disturbance of the qi in an organ system, now qi was one level lower. So if we think of the Shen as the blood flow, the qi might be thought of as more the nerve activity. And we discussed that earlier, the activities there in the nerves. So the nerves are connected here with the Shen, but there's an additional aspect through the blood that's maybe not as addressed through conventional thinking at this point. And we think there are 6 climactic factors in Chinese medicine, 7 emotions, and diet, lack of exercise, sexual imbalance, drugs, meds, which all can affect the flow of qi in organs, and then that can affect the Shen. There are different Shen patterns. So Shen deficiency is more dullness, apathy. That would be lack of affect, blunted affect. Then there's Shen excess, which would be more like a psychosis, mania, or at least anxiety. And then Shen obstruction would be more confusion. That would be more like delirium that we had discussed in the neurological section, dull depression, unconsciousness. And we can think of then Shen as sort of organizing the whole. So if we think of Jing as your life activity, life essence, Qi is more related to your soul activity and the nerve activity and so forth. And then Shen has more of a guiding influence, might link that more to spirit, having a higher organizing role of the body. That's one way to understand it. Importantly, again, we can link organ systems with each of these aspects of the soul, the mind, the Jing Shen. So the Shen itself, we can connect that with the heart and its yang organ is small intestine. And there are certain characteristics of imbalance you can read through there. The Hun itself is connected more with the liver gallbladder system, the wood element, and that has more to do with drive, with planning, with purpose, and so forth. So you say Shen is your ultimate purpose, and then trying to implement that, kind of make it work in the world, would be through the Hun. And then the Po would be more connected with the lung, large intestine systems, that's metal. And this is more related to your sensory life, but also we can link different emotions like grief and so forth to the Po disorders. Hun would be more anger. And then Shen is actually defined as problems of joy, either lack of joy or even too much. That would be almost like a psychotic mania. And then Yi is the spleen, stomach, the earth center, and that's more related to your intellect, your ability to actually take in either sensory data or foods, digest it, and then process that, and then take that further. That's part of that aspect. And then your will, Jur, seated in the kidney system, it's thought, and that's related more to kind of longer term, like poor concentration, poor memory. So this sort of moving into dementia could be seen potentially as a problem here on the will level. So that's one organization. I took this from Claire Stevenson's book, Acupuncturist's Guide to Conventional Medicine, so you might want to look there for more detail on this. Now, we discussed this earlier, but if we look at the embryology of the nervous system, the whole nervous system comes from the neural tube and the little cells outside the neural tube, but basically all comes from ectoderm. And if we look at that embryo at the end of the 3rd week of development, it looks in cross-section like a little worm surrounded by the amniotic sac and fluid, but we have inside there 3 tubes. We have a neural tube, we have the aorta, and then we have a gut tube. And the neural tube will give rise to the brain and spinal cord. There are some cells outside of that which will give rise to your peripheral nervous system and autonomics. And then your gut tube will give rise to your digestive lining, as well as your liver, your pancreas, all the organs of digestion. And then the aorta is connected here with the cardiovascular system. This is mesodermal tissue, which gives rise to your connective tissue, blood, heart, spleen, and kidneys. So if we kind of look at this, we find that the neural activity, remember, is related more to the yang, more the forming, the shaping forces, and the activity arising from the gut tube is more yin, substantive filling in a sense. And in the Chinese classics, we have this notion that the governing vessel, which gives rise to all your yang meridians, if you look at the path of the governing vessel, it correlates almost identically with the neural tube. So we can correlate the governing vessel with the neural tube, and we can say that gives rise to all of your yang meridians, which are hollow, and they're actually very nerve-rich. So the walls of these organs have a lot of nerves in them. If you look at your gut tube, that correlates with the conception vessel, and that gives rise, is said to give rise to all your yin meridians. And these are more solid organs. So we can say they're more involved in energy metabolism, substance metabolism, and so forth. They do have nerves, but we can say they're less innervated overall than the than the yang organs. And then we have the chongmai in between, correlating with the aorta, and that would be part of your rhythmic activity, your heart beating, your heart rhythms, as well as your respiratory rhythms. So if we put all that together, we can think of the governing vessel correlating with the neural tube, giving rise to your nervous system, basically. And this is, again, the nerves have this impulse of forming or shaping. This is what the alchemists refer to as the salting activity. So we can think of the shaping forces coming from the governing vessel, and then the substantive filling forces, more yin, coming from the conception vessel. And these are related more to your endocrine processes and your metabolism, and the alchemists call these the sulfur activities. So if we correlate that, we can start thinking about how different neurotransmitters actually relate here to different organ systems. So I've already mentioned this connection potentially between serotonin and the earth forces. And we often see serotonin is often linked to worry. And we often say in Chinese medicine that people that worry a lot and whatnot have an earth imbalance. Well, in biomedicine, we'd say they have a serotonin imbalance, interestingly. And there's a high correlation here also with the pancreas and with insulin. Glutamate more is your primary excitatory neurotransmitter for waking consciousness in the central nervous system. Allows you to think intellectually. It allows you to create thoughts and organize them, which has a metal-like effect. And the thyroid actually plays in with this. Acetylcholine, more your parasympathetic nervous system, primary neurotransmitter in terms of the peripheral nervous system. And that has a very calming, rest and digest, regenerative effect. We can think of that as an aspect of kidney. So would GABA, that's another calming neurotransmitter. We can think of an upper and a lower kidney. And then that would correlate with your adrenals and your gonads hormonally. And then dopamine we can think of that more as our wood hormone. So people with a lot of good dopamine have a good drive, they have good planning, they're able to put that together. If that gets excessive, we often see anger, even rage with excess dopamine. And we see that actually in schizophrenia, often during acute psychosis. This is thought to be like a surge of dopamine and dopamine activity. That's a wood activity. And then pituitary, we'll talk about this later, we can link that gland here. And then epinephrine, more as a fire element. Epi is, it's also known as adrenaline. Gives you that surge of fire, this kind of immediate catabolic effect. You break sugars down and whatnot for energy, you break fats down for energy, and you get this surge of energy. And I'll come back to thymus. That's a more difficult connection. Thymus is your primary immune system regulating organ. And then norepinephrine also is an aspect of fire here. I'm linking it here with triple burner. I don't have a hormone here connected with pericardium. I have a couple of ideas we can talk about later. But basically, that's one way we can maybe think of how to correlate the different neurotransmitters with the organ processes in the wuxing in Chinese medicine. So we've already discussed this idea of threefold physiology, and the reason I'm bringing it back here is, again, to really sort of emphasize this point that what we often equate the mental health disorders with the brain, but the emerging research is really the mind itself and your feelings and everything else is related not just to the brain. In fact, we can think of the brain as receiving the impulses from the body and then becoming conscious of them. But your organ systems play into this. So if we kind of look in general at your nerve sensory system, this gives us the capacity for, again, forming tissues. This is that yang catabolic activity I just spoke about. And we can relate our thinking specifically to the nervous system. So we say, what do we do in the nerves? We think. And if you actually look at how we think, if you just draw on a piece of paper, like one thought connecting to another and then maybe branching off to a different thought, if you've seen those kind of flow charts, they almost look, if you just back out and look at those little bubbles and arrows, they look like neurons. It's the same, we can say the same pattern that the nerves lay down, we use in our thinking process. And I mentioned earlier in the term that if this process gets the upper hand, if the nerve activity anywhere in the body becomes predominant, in a way we can say in the soul life, if thinking becomes hard and overactive in a certain sense, we can get what's called sclerosis or hardening. So we can think of hardening pathologies like atherosclerosis and Alzheimer's almost from an overactive nerve activity, either in the brain or somewhere else like an arterial wall or something like that. As opposed to that would be all of the substantive processes coming in from your digestive tract. And this is linked to what we might call the metabolic limb system, limb being your muscles. And your muscles need to be fed all this glucose and all these nutrients from the liver, so we can kind of connect the liver, for instance, with the muscles that way. But all of your digestive organs, even your reproductive organs and your renal organs, these are really where your anabolic activity. So very different than the nerve activity. The nerves in a way tear you down to provide for the consciousness of thinking, versus the metabolic forces build you back up again anabolically. So you can say it's very yin in activity, yang in the substances. If you look at the substances made by the liver, they are packed full of energy. So think of ATP, for example, is a very yang substance, but its effect is yin. It actually is going to help nourish and provide for all those downstream metabolic reactions. And if we ask what activity in the human soul life is centered in the metabolic system, it's not your thinking. You don't really think consciously with your liver or your other organs, but we will with those organs. So the seat of your drives, your passions. Now, most people are controlled by those organ processes. So for example, it's been shown that you think you need to go to the bathroom, but actually your bladder sent up a signal milliseconds before you consciously perceived that and made what you thought was a free choice. Your bladder actually did that for you. But we do know there's a capacity in certain meditative states and with inner development to actually begin to tap into the organ will forces and to use them in a very constructive way. So that gives us another possibility here. But it says that, for example, in conditions like depression, we often find people that actually are thinking very clearly. They're often thinking too much about their condition, but their will, the ability to get up off the couch and to actually motivate, put a plan together and so forth, that's lacking. And in Chinese medicine, we'd say that's specifically more of a liver will aspect. There's also a kidney will aspect and so forth. If these will metabolic forces predominate, interestingly, then we get acute inflammation. So we always have a balance in the body between hardening and cooling off processes and warming, dissolving, acute inflammatory processes. And they have to be kept in a balance, and that's what your heart and lung rhythms are really all about. They are really maintaining the balance between the nerve sensory forces and the metabolic forces. And we can think of the yin and the yang alternating in activity. If we ask what is the human soul aspect seated in these rhythms, it's feeling. So it's very interesting, and this is corroborating a lot of current neurological research showing that feeling is actually not something that starts in the brain. We of course saw the limbic system is what we think is the seat of feeling in the brain. But we know that the limbic system receives projections, sensory neurons, from your different organs, in particular your heart and lungs. So we can think of those organs as providing feedback to the brain, and then you become aware, conscious of a feeling. But the feeling itself started in a change in the heart rhythm or the breathing rhythm, and it happened at more of a subconscious level for you. So that's a very interesting idea, and that requires a lot more discussion to kind of elaborate that. But again, it shows you that disorders like anxiety and so forth, feeling disorders like this, may not have their seat in the brain, but have their seat in a dysregulated heart organ system or lung organ system. And I'm using the Chinese medicine terminology here. So it really expands our ability clinically to look at mental health disorders as really being an issue of the whole embodiment, not just a problem in the nervous system. Now, I had mentioned this interesting hypothesis that if you look at neurons, and if you actually cut a neuron open in a way and put a very sensitive camera at the end of the axon, you find that neurons release light. And we think that light is actually coming from their microtubules, which are hollow, and that some of the light is generated from the mitochondria within the neurons, and perhaps even in the DNA itself, there's a light generating aspect. This idea of light, of course, the particle of light in physics is called a photon. So these are known as biophotons. Of course, these are both particles and waves. They have both properties. That's that strange particle-wave duality in physics. But Fritz Albert Popp was one of the first to really systematically study this. Others before him had kind of developed this concept. But Popp found that the biophoton waves and the photons themselves were what he called coherent. They were organized like laser light. All of the peaks and troughs of their waves were synchronized. And to him, that said, this is not a random system in the body. For example, a lot of chemists said, yeah, there's light in the body, but it's just from random chemical reactions. We know that happens anytime there's a chemical reaction. But what Popp showed is that this light is organized, it carries information. And the nerves themselves are very rich in these microtubules and provide sort of the perfect channels for light propagation in the body. And there's an interesting theory of consciousness called orchestrated objective reduction right now. This is still the major problem in neuroscience, is how does the psyche, the mind, the emotions, everything else, come from neurons? How does it come from physical tissue? Because, a feeling, a thought is not measurable, but we can measure a neuron and its activity. So how are they connected? It's almost like one is just spontaneously coming from the other. And what a lot of people now posit is what they call, psychobiological parallelism, where they say, well, there's the body, the neurons, and then parallel to that are the mind activities. But we're really going to just focus on the body because that's what we can study. And so a lot of the research is shifting more and more, ever more, into looking at the physical mechanisms behind different mind states. Still, that issue, how is consciousness generated, is still a great mystery. Well, this particular hypothesis, ORC-OR, was put forward by Roger Penrose, who's a physicist. He was Stephen Hawking's mentor, and then Stuart Hameroff, who's an anesthesiologist. And they posit that consciousness actually arises from quantum activity within the neurons and potentially any cells with microtubules, which is pretty much everyone, using light. And that in addition to your action potentials, which is a fairly slow electrical system in the brain, you also have this inner light signaling, and light can be superimposed, different light frequencies. You can have weird effects called quantum entangling. I'm not going to get into all that here. But basically, they were arguing that this is the basis of consciousness. This is controversial, but interestingly, this hypothesis they put forward many years ago. I think it's been over 2 decades now. And there's actually, they predicted things that could be measurable from this hypothesis, and we've actually now measured those things. So there's a rekindled interest in looking at ORC-OR as potentially a model of consciousness. This sort of idea of the light body, we spoke about this in relationship to the Hun, or what in the Western tradition they refer to as the astral body, as a body carried, is sort of a light body that's carried by your nerves. Alex Gray is an interesting artist, and I grew up in Ohio. He was also there in Columbus, Ohio, and he, painted these incredibly beautiful paintings of what we might say is part of the aspect of the light body, and often it's seen as sort of a glow like an egg around the body. But we can say it's carried by the nerves. It concentrates in different bundles. These have been known historically as the chakras, but interesting, if you look at each of these places, there is a autonomic nerve plexus. Here in the brain, we have the hypothalamus pituitary, and behind that we have the pineal. So very interesting how we can think of, if you just look at these nerve aggregates, look at potential light correlations, we'd find there'd be more light around these nerves. Interestingly, if you look at the back, which is not shown here, right around L2, there is the major autonomic plexus that innervates the adrenals. And if you again think that wherever you see a nerve bundle, there's probably an inner light phenomena, if you observe that from a different state of consciousness, the Chinese actually have a name for this region. They call it the Mingmen, or bright gate. Very interesting that we might argue that in a different state of consciousness, there would be a tremendous light coming from there. Curiously, also, there's a pelvic plexus by the bladder, and in the name, Chinese character name for the bladder, there's a character for light, like a lantern. So very interesting how maybe at one time people could perceive this inner light phenomenon, and we just have lost that perception. I've spoken about this interesting correlation that really the nervous system, the so-called neural hypothesis of acupuncture, is becoming predominant. That really, if we ask what does acupuncture do, you're tapping directly into the nerve activity as well as potentially the light body, and you're causing physiologic changes that way. So, here's just one article from JAMS, Journal of Acupuncture and Meridian Studies, 2010. Conclusion here: it seems clear that the peripheral and central nervous system can now be considered to be the most rational basis for defining meridians. So we can think of the meridian aspect as related to the nerves and the fascia they're connected with. And then again, on top of that, we have the circulatory system, and that's relating more to the Shen aspect. So the question is, can you affect the Shen through acupuncture? Yes, but not directly. It's more indirectly through the nerve activity. And that's maybe the basis for a later discussion. But that's maybe can be helpful maybe for giving you some orientation around how to fit the acupuncture meridian concept into neurology. So let's go back to mental health disorders and how they're classified. Usually they're grouped by characteristic signs and symptoms into what's called a syndrome. And again, DSM-5 is kind of the gold standard in terms of how the definitions are made. I'll just say there's a lot of controversy about DSM-5, and I'm just using it here as a reference example, but certainly this is not a complete or by all means comprehensive kind of approach to mental health disorders. So the benefits of this kind of approach of grouping mental health conditions into signs and symptoms really has some benefits. It can create more of a standardized approach. It sort of aids communication amongst providers. It gives some standardized diagnostic approaches and treatments, and then a standardized approach to research. So there's benefits from classifying mental health disorders this way. There's some problems because it can severely oversimplify issues. A lot of these mental health conditions are not always clear. They overlap one with another. So a good example is depression and anxiety. They're often overlapping. And again, as we'll dive into each of these, we'll find that we could very well link some of these conditions to organ imbalances and find there's, maybe a mix of a problem in the liver and the kidney system functionally. And you might have an overlapping of depression, anxiety as a result of that. So it's these mental health disorders are not necessarily clearly cut disease states. They are often blended with one another. And so this kind of system of classification can be a little bit misleading in that way. It often labels the patients with the disease when really it's more indicating an imbalance, not so much a disease state. And it may lead to incorrect diagnosis and treatment if the criteria are not rigid enough or practitioners misinterpret them and maybe initiate treatment that's not indicated. And interestingly, we'll find that things like depression, for mild to moderate depression, turns out a lot of the studies are now showing the SSRIs, for example, selective serotonin reuptake inhibitors, maybe no better than placebo, or even worse, they might have a nocebo effect. So here we got some issues with this approach. The two major classification systems right now, again, I mentioned DSM-5, and that's from the American Psychiatric Association. That was last put out in 2013, I believe. And then the ICD-10, which is put out by the World Health Organization, and Chapter 5 focuses on mental health disorders. So those are the two systems we'll be discussing here. Some definitions that are important to know about. Organic is a condition that has a measurable physical basis. So example would be brain tumor, brain damage. Those would be organic lesions. Psychoactive is anything, such as a substance that has an effect on the function of the mind. So caffeine is a psychoactive substance, so is LSD, etc. Affective is used interchangeably with mood. So affect disorders or affective disorders are also known as mood disorders, and depression is a classic example of that. And we'll see there's many subtypes of depression. Neurotic means a minor mental health disorder. Importantly, the difference here is that in neurosis, the person knows they have something, an imbalance. So they feel anxious, they feel depressed, and they're actually seeking help for it. So that's a neurotic condition. A psychosis, though, the patient has lost insight into the fact that they have a mental illness. So they think they're totally fine, the whole world's out to get them or something, but they're not realizing that maybe they're partly involved in this. Somatoform is a condition where the mental health disorder is experienced as a bodily problem or physical discomfort. It's a very, very high rate of somatoform disorders in patients who have kind of gone through a lot of the medical diagnostic systems have failed. They sometimes end up with acupuncturists and things like that. Now, unfortunately, what people often do is that they just sort of trivialize their condition, say, oh, it's all in your head. But really, these somatoform disorders are real. They have organic physiologic changes, but they're often correlated with a mental state. And so if we can address the mental state, that often can dramatically change the physiology as well. And then a personality disorder is a deeply ingrained and enduring behavior pattern, manifesting as inflexible responses to a broad range of personal and social situations. And so several types would be things like cyclothymia, mood swings, dysthymia, very low mood, paranoia, negatively interpreting intentions of others. We'll talk about all the different personality disorders like bipolar, histrionic, and so forth. Those are important to recognize because a lot of times patients don't have insight into the fact that they're creating a lot of damage to people around them. They're harming themselves and in other ways as well. So pointing all that out can be helpful to them in a very delicate and gradual way. So we'll talk about personality disorders and maybe how to address those clinically. Here is a list of all the different disorders, both in ICD-10 and DSM-5. We're going to focus on DSM-5. There are 21 categories in Section 2 of DSM-5, and we're going to cover in the notes all of these. So we're going to look at dementia, depressive disorders, bipolar, anxiety, OCD, PTSD, schizophrenia. We'll look at these somatoform disorders, feeding and eating disorders like anorexia, bulimia, personality disorders, sleep-wake disorders, and then things like ADD, ADHD. We don't have time to really look at some of these others, but this is something that you could study and read on your own. So looking at things like dissociative disorders, sexual dysfunctions, gender dysphoria, substance and addictive disorders, that's a big one with substance and addiction abuse. We find that a lot, not only with recreational drugs, but also with medications, opioids and things like that, and so forth. So I'm not going to focus too much on those, but we're going to cover in a good amount of detail this first list here. So let me say a little bit about assessment of mental health disorders, and then in the next lecture here we'll look at treatment and kind of the general treatment options. Really, we need to properly assess a lot of mental health disorders. You need a combined approach with a lot of different primary care providers, mental health specialists, and that could include things like psychiatrists. We now have nurse practitioners who do additional training in mental health, so those are mental health nurse practitioners. They're often more available than psychiatrists. Psychiatrists usually are quite booked out, very difficult to get an appointment with them. And so a mental health nurse practitioner might be a little bit better that way, and they often can get the level of care they need through that person. And then different allied providers such as acupuncturists. So all this could be part of the team for a patient. A lot of patients will present to acupuncturists with a mental health disorder without a formal diagnosis. And there's a few things we can do to see, do we need to refer them, or is this something we can just kind of handle with the care we're giving? So here's a couple of steps to think about. So step one might be to use, and I don't think this is widely done in the acupuncture circles, but we do this a lot, for example, in the naturopathic circles and so forth in primary care, and that's to use a screening tool if you suspect depression or anxiety. And classic examples would be the PHQ-9 for depression, Patient Health Questionnaire 9. There's 9 questions. And then for anxiety, the Generalized Anxiety Disorder Scale, or GAD-7. These are available online. They're questionnaires you can print out, have the patient fill out, and it gives you kind of a ballpark as to how severe a person's depression and or anxiety is. Is this something we need to really be alert about? So for example, one of the questions on the PHQ-9 is about suicidality, and if a person has plans, if they actually, how far along in that planning process are they to committing suicide? And if the patient, circles 3, which is the highest score, that's a really red flag that we need to intervene and provide them the right services. Versus, a person with a mild depression, this is probably something, and it might be situational, something that we can address by maybe reducing their stress and working with the acupuncture that way. So that can be very helpful, using the screening tool to sort of gauge the severity and urgency for need of referral. And then step 2 would be if a mental health disorder is suspected, really it's good to get a full workup. So if the patient hasn't seen a doctor, they don't have a PCP, not a bad idea to just make a referral, at least to their PCP. Now, if there's a deeper issue, that's maybe where the psychiatrist and mental health professional is going to get involved. But typically we get a very full history, psychiatric history, for any patients with mental health disorders. That would include the history of present illness, their family history, social, occupational, relationship history, detailed history in childhood development, their whole psych history, all the medications, supplements, and then potential substances they're using, presence of any other medical conditions like hypothyroidism, type 2 diabetes, etc. And then maybe doing the Minty mental state exam, which is another questionnaire, little survey the patients can do. And then looking for the presence of any red flags. So I'll talk about that here in just a moment. And then, importantly, we do a physical exam, and we're trying to rule out any organic medical conditions. So that would be neurological, that could be endocrine, again, huge role in the endocrine system, so things like hypothyroidism or hyperthyroidism, Cushing's, which is excess cortisol, etc., would all be things we'd look at. Looking at substance abuse or withdrawal, etc. So we might do drug testing and so forth. So all of this would be part of the kind of general workup. Usually a primary care physician would initiate all this. And then if there is a need for referral to the specialty, that would be made at that point. So step 3 then would be, let's say you did step 2, if that was part of your training and that was, interest, you had some additional training in that. Step 3 would be to determine the type of mental health disorder according to DSM-5 criteria, the severity, and then you have to determine what level on the therapeutic order is appropriate. And I'll discuss that in the next lecture. Do we need to jump right through immediate urgent referral? Do we need to send them right away to their PCP or maybe a specialist? Or is this something we can handle in office and intervene at a lower level on the therapeutic order? Now, a lot of patients are resistant to the idea of referral. And so this is where it really should be in any clinic you work in, there should be an institutional policy around that. So for example, I'm sorry, we can't treat you until we get a formal workup, or we can give you a certain number of treatments, but we need to promise us that you'll get this referral in a certain amount of time, or something like that. And that's all clearly documented in the charts, because if there is a potential problem here legally, you need to make sure that's all documented and that you have a clear policy around that. So, that patient you think has mild depression goes home and commits suicide, and now their family can come looking for, why didn't you make the appropriate referrals? Were they even worked up at all? Did anyone, with the right training actually look into this? So these would all be really important questions to keep in mind. Now, the mental state exam, again, we assess the following things. We look at appearance and behavior, their speech, especially the rate, articulation, the quantity, and the form of the speech. And then we look at their mood, the content of their thoughts, any abnormal beliefs, abnormal experiences, the thought itself, their cognitive state, and that would be their orientation, memory, attention, concentration, intelligence. Again, there's a standardized clinical tool called the Minty Mental State Exam, MMSE, that can be used for that. So patients who are maybe delusional, they're maybe psychotic or something, this would be very helpful as part of the assessment. Now, red flags to keep in mind, and this would be the urgent referral, so suicidality, so that's the big one. So if they talk about that, they indicate that on the PHQ-9, then we need to really assess the severity, their level of intention around it, and then make an appropriate referral. There are suicide crisis hotlines and so forth that they should have those numbers to call, and those are available 24 hours a day. If the patient's having hallucinations, delusions, severe thought disorders, this probably indicates psychosis like in schizophrenia. And this could really be a problem with deteriorating self-care, personality change. They could become aggressive and harmful maybe to others around them. So that would also be an urgent red flag referral. Features of mania, like really increased agitation, pressure of speech, that might be a mania bipolar. We'll talk about that. That also would be something, okay, this is more than we can handle right here. We need a referral out. We can work adjunctively with you, but we need this additional care in your case as well. Evidence of an organic mental health disorder. So that would be, if they're having very significant deterioration in their cognitive capacities and so forth, they would just need to get worked up to be sure there are not any severe deficiencies, endocrine issues, again, vascular issues may be contributing to dementia. There could be substance abuse, and that could even include prescription medications. We know, interestingly, a lot of patients now that present with dementia, actually, we think it's from their medications. And so that needs to be formally assessed and worked up by their doctor. Severe depression, severe OCD, anxiety, where a patient's not responding to treatment and it's severely affecting their activities of daily living, that would be a referral. Severe disturbance of body image, again, not responding to treatment, like in progressive anorexia and bulimia, where the patient has severe weight loss, they're no longer menstruating, they have chronic forced vomiting, they have electrolyte disturbances, that needs a referral. Features of autism, slow development of speech, impaired social interactions, little imaginative play, obsessional repetitive behavior. So if this is a first-time patient presenting with you, you're going to want to work as a team with a group of providers. That's something that's very difficult on your own to manage. So that would be another indication for referral. And then postnatal depression, especially if it's severe depression, not responding to treatment with even psychosis, again, that would be an urgent referral. Some of these referrals, are urgent, like in the case of suicidality, like right away, let's send you to the ER, something like that, or let's get you to a suicide hotline connection, something like that, or a person with, that's in very agitated, they're very angry, they're hitting, and so forth. They can actually be restrained in the hospital. You can put them under a 72-hour psych hold and things like that until they're stabilized. But a lot of this depends on the patient, following your recommendations to get the referral. And some of it doesn't have to be necessarily right away. So like in the case of autism, this is something like, let's get a team of people set up for you. Let's take the next couple of weeks to get that together and so forth. So you have to kind of use your intuition and judgment in terms of how urgent it actually needs to be. So that's a little discussion about assessment of mental health disorders. And then in the next lecture, we'll look at treatment and treatment options, and then we'll dive into each of these conditions separately.